Hello friends, this is Dr. Shashikant Bagade with the learning episode of second year B.Pharm, 4th semester. We will be discussing the topic from the syllabus of Dispensing and Community Pharmacy. This lecture is divided into 5 modules including Module 1, Introduction to Pharmaceutical Care, Module 2, Definition and Principles of Pharmaceutical Care, Module 3, Emergency Treatment in Shock, Module 4, Emergency Treatment in Snakebite, and the last module, which is Module 5, Emergency Treatment in Burns. Here we start with the Module 1. This Module 1 which deals with Introduction to the Pharmaceutical Care. Let's start with general introduction about pharmaceutical care. You must be aware about prime objective of pharmaceutical care and the clinical pharmacy, the allied branch. It is to describe how clinical pharmacy and pharmaceutical care can contribute to improve quality of drug therapy. Friends, the concept of pharmaceutical care was introduced in 1980. It says, pharmaceutical care includes determination of the drug needs for a given individual and the provision not only of the drug required but also the necessary services, that is, before, during or after the treatment. This is to assure optimally safe and effective therapy. It also includes a feedback mechanism as a means of facilitating continuity of care by those who provide it. Based on the other writings, the word care is intended to evoke analogies to medical care and nursing care. Here the responsibility was defined in its prospective sense as moral faithfulness, which may include behaving to the full extent of law and custom as if one expected to be accountable for one's action. This concept of responsibility does not presume full authority over pharmaceutical care or patient care. Recently, in 1998, a new definition of pharmaceutical care is emerged. It says, a practice in which the practitioner takes responsibility for a patient's drug-related needs and is held accountable for this commitment. In the course of this practice, responsible drug therapy is provided for the purpose of achieving positive patient outcomes. However, it is important to note that a pharmaceutical care provider could satisfy the definition of pharmaceutical care, which is very prime important here. As a part of conclusion, the definition of pharmaceutical care can be, it is the function which should be carried out by the pharmacist for patients. Let's have a look at principles of pharmaceutical care. Here, the module 2 includes definition and principle of pharmaceutical care. The principal goal of pharmaceutical care is to achieve positive outcome from the use of medication that improves patient quality of life. Therefore, the pharmaceutical care is defined as the responsible provision of drug therapy for the purpose of achieving definite therapeutic outcomes that improve the patient's quality of life. Such outcomes includes number 1, cure of a disease, number 2, elimination or reduction of symptoms, arresting or slowing disease process, this is number 3, number 4, prevention of diseases, number 5, diagnosis of diseases, and desired alterations in physiological processes, all with minimum risk of patients. Please note, at this point you must know what are the different types of pharmaceutical care, which may include finding complaints about severe cases, managing laboratory data just like blood pressure, weight, height, blood pressure related complaints and pulses, diagnosis or explanations for the patient's medical problems, planning drug dosing or surgical procedures, identification of patient's need, which is very important here, recognizing problems may be adverse drug reaction, which is known as ADRs, through subjective and objective informations, making observations, planning counseling and recommendations to the patients. Along with this, you must know the basic elements of pharmaceutical care. Such elements includes patient-oriented factors, both acute and chronic problems addressed, stress on prevention of drug-related problems, documented system on patients, record needed or care needed, offering continuous care in systematic way, taking help of others or other healthcare professionals, or at the same time highly accountable and responsible jobs can be done. The emphasis should be on optimizing patients' health and quality of life. Also, the stress should be given on patients' health education and health promotion. Apart from this, pharmaceutical care involves the process through which a pharmacist cooperates with the patient and other professionals in designing, implementing and monitoring a therapeutic plan that will produce the specific therapeutic outcome for the patients. So, these are the elements of pharmaceutical care which are leading to there are three major functions for the pharmacist to perform. Which are these functions? Let's see. Number 1, identifying potential and actual drug related problems. Number 2, resolving actual drug related problems. And number 3, preventing potential drug related problems. Number 4, the pharmacist, who is the center figure of pharmaceutical care, then he has the following functions to be performed. While performing all the functions, there are several tasks for the pharmacist to accomplish at the pharmacist workstation. Number 1, collection of patient data. Number 2, identification of problems. Number 3, establishing outcome goals through a good therapeutic plan. Evaluating treatment alternatives by monitoring and modifying therapeutic plan. Individualizing drug regimes. Number 6, monitoring outcomes. After getting the fair idea about pharmaceutical care, let's see the emergency treatment of shock, snake bite and burns, where the role of pharmacist is revealed. Here the module 3 deals with emergency treatment in shock. To start with this, you must know what is shock. Shock is a rapid deteriorating syndrome caused by an inadequate capillary perfusion of vital tissues. If the condition is not treated properly, it leads to death. In shock, the cardiac output and blood pressure are generally but not necessarily low. Shock is divided into two categories. Category 1 or the vasodilation shock. In this case, there is decrease in sympathetic activity and an increase in parasympathetic activity. There is decrease in the blood pressure. The category 2 of the shock includes vasoconstriction shock. In this case, there is increase in sympathetic activity and decrease in parasympathetic activity. There is high blood pressure in this case. There is decrease in function of brain, kidney and heart, which causes mental clouding, respiratory failure, decrease in urine output, myocardial infarction. Friends, the table on your screen shows the shock and its etiology. Now, the types of shocks been listed here. First is cardiogenic shock. Its etiology includes myocardial infarction, low output cardiac failure, cardiac dysarrhythmia. Here, the rhythm of the heart is disturbed. The second type is hypovolemic shock. In this case, the first point of etiology is loss of blood due to hemorrhage, loss of plasma due to burns, severe dehydration due to diarrhea, vomiting, heat stroke, diabetes insipidus or overuse of diuretics. The third type includes neurogenic shock. In its etiology, spinal cord injury, after spinal anesthesia, drug induced due to drug like daunorubicin, abrimacin fourth type includes bacteremic shock, which is a septic shock, or we can call it as a sepsis. This etiology includes gram-negative septicemia and gram-positive septicemia. Here the fifth type says hemo-obstructive shock. In this case, blockade of main blood vessels, pericardial tamponade, pulmonary embolism, dissecting aneurysm of aorta is observed. The last type is, there are subtypes which are included here, which is anaphylactic shock, hypoglycemic shock and hyperglycemic shock. In case of anaphylactic shock, after injection of penicillin or cerium, there is a etiology which is discussed. Here the table is showing a very limited types of shock, but it is not as such limited, but it can be improving. Nowadays, different types of shock are also included in this case. After getting fair idea about types of various shocks, let's move towards the emergency treatment to be adopted in shock. The emergency treatment includes, number 1, place the patient in the supine position and elevate the legs to increase venous flow to the heart, which is shown on your screen. Point number 2, the patient should be shifted as early as possible to the hospital. The line of treatment number 3 includes, give dopamine through intravenous infusion. Then oxygen inhalation is given to correct hypoxia. The use of corticosteroid is also recommended in this case. The use of fluid and blood plasma or saline for replacement therapy can be adopted. During anaphylactic shock, adrenaline is the drug of choice and given in the dose of 500 to 1000 microgram per intravenous infusion, along with antihistaminic drugs. In septic shock, in addition to the general measures, antibiotics are prescribed. Here, the module 4 deals with emergency treatment in snake bite. Before going towards treatment of snake bite, let's have a look at different snakes and their poisoning. On the basis of poisons, they are secreting or secreted the poisonous snakes belonging to 3 families. First family is Elapidae. See the figure which is on your screen. These are the neurotoxic in nature. For example, the snakes include common cobra, king cobra, krait, coral snake, tiger snake, mambas and death adder. The second family includes Viperidae family. Again, see the figure of this Viperidae family. These are all vasculotoxic. The example includes Russell viper and saw scale vipers. Along with that, pit viper and common green pit viper included. Here the third is Hydrophidae, mitotoxic. If you see the photograph of common cobra, you will see marks shown on skin. The cobra is showing certain marks which are identification marks which are there on the skin. There is a vast difference between poisonous and non-poisonous snakes. The table shows comparison between poisonous and non-poisonous snakes, and there are certain factors which are used to have this comparison. The factors include belly scale position, head scale position, fangs, tail, habits and teeth bite marks, which are very well known and well observed. If you compare the head scale, usually viper shows small scale and the non-poisonous snake shows large scales. Exceptions are also there in this non-poisonous case. If you compare this belly scales, a large covering entire breadth of the belly is observed in case of poisonous snake and small size is observed in case of non-poisonous snakes. The tail, if you compare, is a very prominent part of the snake. Poisonous snake shows tail which is very compressed, but here non-poisonous snake shows the tail is not well marked and compressed. The habitat or habits include the poisonous snakes, usually nocturnal in nature, but here in case of non-poisonous snakes, no special observation is there. And if you compare the teeth bite mark, which is a prominent part which is observed always after the snake bite, is the non-poisonous snake shows two fang marks with number of small teeth marks. But in case of poisonous snakes, it shows two fang marks with or without marks of other teeth. So, you got the fair idea about non-poisonous and poisonous snakes. You can see the other image which showing poisonous snake or non-poisonous snake bite. Here, the poisonous snake bite is prominently mentioned because which is very important. When a snake bites, it may excrete venom, but this is depend on the type of snake, which could be venomous or non-venomous. Snake venom is a toxin, could be hematotoxin, neurotoxin or cytotoxin. It is a varied form of saliva excreted through a modified parotoid salivary gland, which are located on each side of the skull behind the eyes. It comes out through a pumping mechanism from a sac that stores the venom. It proceeds through a channel down a tubular fang hollow in the center to project venom. Now, let's see what to do when there is a snake bite. The treatment of snake bite includes, the first point includes, first of all, certain important things need to be checked, which are time of the bite, activity at the time of the bite, first aid action taken since the bite, clinical examinations done, and observations of 20-minute whole blood clotting test. The second point includes encourage the patient to calm down, which is very important. 70% of all snake bites are from non-venomous species. Only 50% of bites are venomous. Here the species actually envenomate in the patient. In most of the cases, if you observe, the third point, which includes stop the patient's body movement in the same way as fractured limb, use bandages or cloth to hold the splints, not to block the blood supply or apply the pressure on any body part. Do not apply any compression in the form of tight ligatures. They can be dangerous. The fourth point includes get the patient to the hospital immediately. Sometimes traditional remedies have benefit treating the snake bite. The last, a very important point, tell the doctor about systemic symptoms such as apoptosis that manifests on the way to hospital. The module 5 deals with emergency treatment in burns. Burns are the injuries caused by dry heat, fire, flame or hot metals, even the chemicals like strong acid, strong bases or electric shock or radiations. The majority of burns occur at home. Most of the time, burns are preventable. Burns may be superficial or depending upon whether the burn penetrates shallow or deeply, which resulting into a partial or complete skin loss. According to a severity of burns, which are classified into 3 categories. Just like first degree burns, symptoms include redness, swelling and tenderness. The second degree burn includes blister formation. The third degree burn, symptoms include the skin become dry, leathery and dead. Just see the figure which is on your screen, which showing the rules of 9 calculating percentage of burns. Here, if you observe the figure, it shows head burn, which is considered as 9% of the each surface area of the body. At the same time, arms or each arm is showing 9%, genitals is showing 1%, Each leg is considered as 18% burn. At the same time, the torso, front or back side is showing 18%, or it constitutes the area of body, which is 18%. Here, the rules of 9 can be used to calculate percentage of burns. Normally, doctor adopt this method to inform the relatives of the patient about percentage of burn. Now, let's start with treatment of burn. The principle involved in treatment of burns include relief from pain, prevention of infection, and treatment of burn area and plastic surgery if necessary. The treatment of burn can be included as cold water must be used to soak burnt area. It decreases irritation. A dry dressing must be applied on the burnt area. Point number 2. The patient must be given whole blood, fluid or plasma. For example, glucose, saline or intravenous fluid can be prescribed. Along with this, rehydration solution must be given in 15 to 20 minutes to compensate fluid loss from the burnt area. In some cases, oxygen therapy must be given. To avoid wound infection, clean, dry and sterile surgical dressing must be used. If tissue is damaged, one can suggest plastic surgery to the patient. In case of eye burns, it can be treated by washing the eyes with pure water, and olive oil can be used or castor oil can be used to cover eye area using very fine cloth or cotton. In case of chemical burns, it could be due to acid. Hence, the affected area must be washed with running water and then with dilute alkali. For example, 3 to 5% sodium bicarbonate solution is helpful here. In case of alkali burns, dilute acetic acid must be used. After local treatment of washing and cleaning of affected area, dry sterile dressing must be used along with antibiotic treatment. In case of sunstroke or sunburns, the victim should be taken indoors and cool body surface by sponging with cold water. Ample amount of water must be given for drinking to the patient. Dear friends, up till now you have gained a fair idea about pharmaceutical care, its type and elements included therein. Also, we have seen emergency treatment in shock, snake bite and burns. You understand that there is a vital role of pharmacist in pharmaceutical care. If you miss any of the topic or module or content, you may cross-check through given references and other web links so that you can stay updated with these topics. Here we have seen role of pharmacist in pharmaceutical care. In this connection, we have seen emergency treatment in shock, snake bite and burns. Also, the introductory knowledge of parts like types of snake, shocks and burns are very important. Friends, do keep in mind what we discussed on today's lecture. It's time for all of you to do some self-study. This is Dr. Shashikant Bagade signing off here. I'll be back with a new topic. If you want to learn more or about this topic, you may log on to our website for MCQs, quizzes or LORs at www.cec.nic.in. Till then, keep studying. Wish you all the best.
Thank you.